Welcome to the first webinar in the mini-series, Collaboration in Action, Community Voice Shapes Policies for Wisconsin Children and Families. Today's webinar is History in Wisconsin, Who is Missing and Why is this important? We're offering Spanish interpretation for today's webinar. I'd like to introduce our interpreter, B. Torres. I'm going to turn it over to B to give you more detailed instructions.
Thank you so much, Susan. Good afternoon, everybody. My name is B. Torres. My pronouns are she, her, ella, and I'm with the Community Language Cooperative, or the CLC. And I want to thank you, as always, for your commitment to language justice, which means that everyone should have the right to speak and listen in the language of their heart. To accomplish this today, we'll be using Zoom's simultaneous interpretation function, which you can find at the bottom of your Zoom screen once we activate it. Once we activate that, you'll see a globe icon and you'll be able to click that icon and select either English or Spanish as the language of your heart. Please remember to speak at a conversational pace so that I'm able to provide an accurate rendition of your message. I'll repeat this in Spanish and then we can get started. Hola, buenas tardes. Mi nombre es Vic Torres, mi pronombre es ella, y yo seré su intérprete con la CLC o la Community Language Co-op, y les agradezco, como siempre, su compromiso con la justicia del lenguaje, lo cual significa que todos tenemos el derecho de hablar y escuchar en el idioma de nuestro corazón. Para lograr esto, vamos a usar la función de interpretación simultánea en Zoom y aparecerá un globo terráqueo en la parte inferior de su pantalla en un momento. Puede hacer clic en ese icono y elegir inglés o español como el idioma de su corazón. Favor de hablar a un ritmo de conversación para poder brindar una interpretación precisa de su mensaje. Muchas gracias, ya podemos activar la interpretación. Thank you very much. We can go ahead and activate the interpretation function now.
Thank you, B. Maybe by next year, I'll be able to do my own interpretation, at least from my slide. I'm Susan Hibbard, the Executive Director of the BUILD Initiative. We're a national organization that advances work on behalf of young children, their families, and communities. And this graphic on the slide in front of you is BUILD's view of the complex it's our view that to address the complex problems that face young children and families, it takes multiple systems and sectors working together, maximizing collective resources, facilitating mutual learning, aligning actions to advance equity. That no one system can address all the needs of young children or families, nor can any one system alone dismantle the barriers and impediments that have marginalized and isolated communities and blocked families from opportunities. The arrows that you see around the ovals that represent the interconnected systems indicate the actions that BUILD supports leaders in taking to advance toward a time when all children reach their full potential and race, place, and income no longer predict outcomes. You'll see the arrow on the upper, sort of a little bit to the left-hand corner, is engage with and center the voices of families and communities. And that's the central theme of the webinar today. We see that as central to the work of BUILD, and the story that you'll hear this afternoon is so important to us and central to systems building work overall. Not only did we work with state partners in Wisconsin to build the two strategies that you'll be learning about today and in the webinars to come, but this is work that is central to leaders in states across the country, and that we know so many of you are working hard on better engaging parents, caregivers, and educators, and that these examples will really help you as you explore that work. We also had the privilege and fun of getting to read the preschool development grants that so many states submitted for the federal grant funding. And one of the things that we learned in analyzing those grant applications was that many, many states are really trying to center the voices of families and communities and have put forth many strategies to do that. So I think this webinar and this topic is, highly relevant and of interest to so many. The work that Wisconsin has undertaken and will be sharing with you was funded by many sources. We worked with Wisconsin through Pritzker Children's Initiative funding with the Prenatal-to-Three hub, which sits at BUILD, but is part of the Pritzker Children's Initiative Prenatal-to-Three work. But it was also funded by the Preschool Development Grant, Birth Through Five, Robert Wood Johnson, many sources of funding that the leaders today will talk about. And you can see in the chat some of the connection to preschool development grant papers that Wisconsin leaders and others helped to write, talking about the strategies in those applications. So now I want to introduce you to the leaders who will be sharing their work with you today. Michelle McKay is president and CEO of Kids Forward, and for the last 15 years, she's served as a senior fellow and consultant at the High Road Strategy Center, which is a national think and do tank. Before that, Michelle served as the managing director of the Anden Group, which is a consultancy specializing in organizational development, innovation management, and evaluation. Their priority in Wisconsin began at the Coalition of Wisconsin Aging Group's Elder Law Center and later as project manager for the 12-county $5 million Department of Labor Wired Initiative. Michelle is a member of the California Bar and had an earlier career in intellectual property litigation and financial crimes investigation. They hold BS, BA, and JD degrees from the University of Notre Dame and an MS degree in criminology and management information systems from Virginia Commonwealth University. And then after her, we'll hear from Ruth Schmidt, the executive director of WICA, the Wisconsin Early Childhood Association. Ruth is a respected leader in early care and education on local, state, and national levels, and a champion for advancing policies that recognize child care as a public good. She joined WICA in 2002, that's the year that BUILD was founded, bringing extensive executive leadership experience and connections across various sectors. Ruth works to maintain and grow WICA's relationship with the early childhood community, as well as with economic and workforce development, local governments, philanthropy, community partnerships, and policymakers. This continues to advance the vision and the transformed systems of care in Wisconsin that support the early childhood workforce, young children and families, and livable communities. And then Dahi Wolfe, the senior policy analyst at Kids Forward. Dahi works and focuses on improving nutrition and increased physical activity in childcare settings, and to elevate the voices of impacted communities to better inform childcare policies and spending. Dahi co-chairs the Healthy Early, an award-winning statewide coalition that promotes healthy eating, gardening, active play, and outdoor learning. Dahi helps coordinate the new Parent Caregiver Equity Advisory Cabinet that exists to empower families and make policy recommendations to the Department of Children and Families Secretary. And before becoming an ECE advocate, Dahi was a public elementary school teacher for 16 years in Madison. He's a graduate of the University of Michigan in his native Ann Arbor with a BA in American culture, and he enjoys fighting for social justice, playing music, trail running, and cross-country skiing. And then last, we'll hear from Dr. Toshiba Adams, who's a professor of child development at Milwaukee Area Technical College and an adjunct professor of education policy at the University of Wisconsin-Milwaukee. In these positions, Toshiba develops curriculum, offers instruction in multiple modalities, and creates engaging and inclusive learning spaces under the guidance of culturally responsive pedagogy. Dr. Adams is also the founder director of a nonprofit organization called Sankofa Consulting and Training that aims to transform student and workforce experience for the early education sector through research and professional development. And I know you're going to really enjoy reading some of the papers that she's written and that others have on this work in Wisconsin. So next, I'm going to turn it over to Michelle, who will kick this off.
Good afternoon, everyone. I'm Michelle Mackey, President and CEO of Kids Forward. At nearly 150 years old, we are one of the oldest family and policy advocacy organizations in the country. We are a multi-issue policy organization that has been working on early childhood education policy for decades, including Wisconsin's QRIS system, Youngstar, nutrition access through Healthy Early, connecting providers to local food sources, and in-depth research on inequities in ECE. We have been partners with WICA and the Raising Wisconsin Coalition for years, from Wisconsin's preschool development grant through this Robert Wood Johnson Foundation funded technical assistance grant. We are very excited to be with you today and sharing two models, but two very aligned and conjoined in many ways models of how we have uplifted the voices of those who usually don't get heard when you're talking about policy reform or funding. In 2021, the history of this collaboration started with the Department of Children and Families reaching out and creating an opportunity to advise what at the time we were thinking was going to be a parent and provider advisory council. However, through a series of discussions, in part with BUILD and other professionals in this sphere, we realized very quickly that it would probably be best to have a safe space for providers and a safe space for parents to learn and to start feeling into their power and then ultimately influencing policy and funding decisions. We knew that given our strong partnership as two organizations, we could have those parallel tracks and still work, as I said, conjoined in our efforts to influence policy and systems change. But in doing it this way, we could really give providers and parents an opportunity to influence directly the seats of power and decision makers. Now, here's the statement of the problem that we had all been seeing, that educators, parents, caregivers, especially those who are most marginalized in our state, whether it's from race, ethnicity, language, rural geography, or socioeconomic condition, all of these folks were not in the rooms for the discussions about program and funding. We have all been there, where some feedback was given, a survey was taken, or somebody came out to see someone in a church basement and somehow those notes were supposed to influence policy. We also know that that often does not happen. That to have parents sitting there with the secretary of the department, that's where change can happen. So we started what has now been a years-long process of thinking about how to get that voice into space together with power brokers. Today, you're going to hear from my colleagues, my fellow adventurers on this journey about those two models. We realize that when we support Black, Brown individuals and those most marginalized, we support better policy and better systems, and most importantly in this moment, better investments for all. This was all a consequence of us seeing and being in space together. So we just invite you all to take advantage of this space, to learn a little bit, to be a little creative, to think about how you might do this in your own states, and then maybe to reach out to us. We are very excited to share different aspects of these models that we won't get through in this entire series, much less in today's event. So with that, I will pass to Ruth Schmidt, my trusted adventurer on this journey towards sustainable and quality ECE infrastructure in Wisconsin that works for all, regardless of race, ethnicity, socioeconomic means, or geography. Thank you very much and enjoy the webinar.
Thank you, fellow journeyer. I love that concept of how we're in this together. I'm Ruth Schmidt. I'm the Executive Director of Wisconsin Early Childhood Association. Want to share just a little bit about who we are. We are a statewide nonprofit organization, and we work with about 90% of both the early childhood educators in Wisconsin and the child care programs that employ them. We do this through a variety of programs and services, including scholarships, stipends, nutrition programs, professional development, and a shared services network for early childhood programs. We are also the state affiliate of the National Association for the Education of Young Children, commonly referred to as NAEYC. This past January, we launched the WICA Center for Policy, Research, and Engagement, home to much of the advocacy and policy work that we do. I've been here at WICA since 2002 and am in apparently really good company with Susan, who was working with starting BUILD at that time. I'm excited to be part of this webinar and to share more about our journey and collaboration with BUILD's Prenatal-to-Three Capacity Building Hubs Equity Leadership Action Initiative that we worked very closely with Dr. Sherry Killen-Stewart on in Wisconsin. The path there started in 2019 with securing funding from Pritzker Children's Initiative. WICA, along with over 35 organizations from across Wisconsin and municipal, county, and state government, began with the goal of establishing policies to help move the needle on infant and toddler care and the health and well-being of infants and toddlers and their families. Originally, the Wisconsin Infant Toddler Policy Project, now known as Raising Wisconsin, the effort went through a year of intense planning, which resulted in a host of policy priorities and advocacy goals. Simultaneous to our work, the Wisconsin Department of Children and Families was carrying out preschool development grant work. Together, we worked to ensure alignment of both inside and outside government approaches to policy and budget considerations. What was unique about the planning process and the implementation phase of this work was the power of bringing early childhood experts, along with leaders from multi-sector organizations and associations, to ensure a broad cross-sector of voices, experiences, and perspectives. Our planning grant year included surveying parents. I think Michelle was talking about sitting in church basements and having conversations with parents. And we did that with parents and educators from across the state and hosted regional parent listening sessions. We did community conversations. We reached out to parents to get their input into the planning process. And very quickly, we learned a critical lesson. When you're working in a state like Wisconsin, you end up with a narrative, goals, and priorities that are very framed around the white experience in Wisconsin. Without intentionality, you risk moving forward with policies that do not consider the richness of community assets and lived expertise of BIPOC parents, caregivers, and educators. Before I go further into my comments, I also want to be transparent and honest about the fact that for many of us, 2019 seems like an eternity ago now, given a lot of changes in the state, country, and world since then, a global pandemic notwithstanding. It is also important to remember when this work started, we were much more direct about calling the work we were doing exactly what it was, work to advance equity. While the work continues, we, as I'm sure many of you do, grapple with changes and directives from the federal administration that challenge our commitment to ensure all children and families see themselves reflected in policies and state budget priorities. WICA and the Department of Children and Families collaborated with BUILD's PN-3 Capacity Building Hubs Equity Leadership Action Initiative program, as I had mentioned earlier with Dr. Sherry Killen-Stewart, to discuss vision and next steps on authentically engaging those who have historically not been involved in decision-making. It was determined that there would be two groups, one with parents and caregivers, the others with educators. The Parent Caregiver Advisory Cabinet was led by Department of Children and Families, and over time funded by Wisconsin's Preschool Development Grant and Pritzker's Children Initiative. WICA commissioned the work of Dr. Toshiba Adams to lead the early childhood educator efforts, and the work included both a year of narrative inquiry centering the lived experiences of early educators who identify as Black, Indigenous, and people of color, and the formation of the Advancing Equity in the Early Childhood Workforce Steering Committee. WICA funded Dr. Adams' work with support from the American Family Insurance Institute for Corporate and Social Impact and Pritzker Children's Initiative. What's important when doing policy work is learning from your aha moments and course correcting in your next steps. I've personally had many aha moments during this process, the core one being to engage the voices of lived expertise, including educators who identify as BIPOC and parents. Raising Wisconsin and WICA have been proud of the work that originated by participating in ELI with guidance from Dr. Stewart. We've been able to give and engage families, caregivers, and educators through both the Parent Caregiver Advisory Cabinet and the Advancing Equity Steering Committee to help inform and drive policy change. I'm excited for you to hear from today's speakers about how this work evolved and continues to evolve. Thank you for your time. And now I pass the virtual microphone to Dahi Wolfe from Kids Forward. Dahi?
Thank you, Ruth. That was a really good overview of everything that happened over the last, like 5-6 years now. And I just really appreciate you highlighting, the intentionality of this, the fact that we decided we needed to both engage educators and engage parents. And of course, the fact that it took different funding sources, some governmental and some nonprofit, to really just be, as they say, braided together and to enable all this to happen over a long time. And one of the things that I always talk about when we, talk about a parent coalition is, sustainable funding, because, there's been so many examples that we all know of, or we've all heard of from communities that where they got, that helicopter or whatever you want to call it in, and the funding ended, and then they were no longer part of anything. And I feel like that's been a really, I don't know, a blessed thing for us that we have been able to maintain this and that we have sustainability, or else we wouldn't be telling this story, I don't think, in the way we're doing it now. So I'm Dahi Wolfe. I'm at Kids Forward, and I've been working in the early childhood sphere for the last 20 years or so. And before that, I was an elementary school teacher, taught 2nd and 3rd grade. So, kind of in that same, pre-K to 3, 3rd grade average, area. So I'm going to start out by talking about, why and how and all that kind of stuff. So we were really fortunate that, as Ruth mentioned, our Department of Children and Families, understood the problem that both Ruth and Michelle described, which is that, the people's voices were missing, particularly Black and brown voices, rural voices, those furthest from opportunity, and that all these decisions were being made without the right people. And then, of course, the other thing is you'll hear a lot of our, if you come to the workshop next week, I think you'll hear that a lot of our parent members really emphasize the fact that if you want to understand the community voices and listen, you have to be asking the right questions. And so that's like the beginning of the process of making sure that when you invite folks, that you didn't start with your own questions and then just show up and expect the parents to ask them. You have to co-design and co-create that so that you know that you're actually asking the questions that matter. So a little bit of history. Our Department of Children and Families contracted with Kids Forward, and then eventually another consultant that'll be on our webinar next week, All Children Thrive, to support the facilitation of the PCAC. So we call ourselves a parent and caregiver advocacy coalition. What does that mean? Why do we say parent and caregiver? And what's the difference between that and what you're going to hear from Dr. Adams about working with the child care workforce and the educators? So as Michelle, I think, really pointed out, we felt like it was important to have a separate space for each. We didn't feel like the parents might not feel like their voices mattered as much, or they might not feel like they had the expertise or the knowledge to speak up in a meeting that also had professionals, that had been in the field and were doing early childhood education. So that was the motivation. And the reason we called it parent caregiver is that we wanted to be inclusive of other folks, that could be, grandparents or other caregivers that were involved in children's lives. We made this dream list when we started the coalition of thinking like, who are all the people that we just love to have here? Like, we definitely wanted to have at least one father. We wanted to have, somebody that was involved with the Birth-to-Three program for kids with disabilities, Head Start, you name it. We listed everything we could think of. We, of course, didn't get all of our dream team, but we sure got a lot of really awesome parents that joined who had a lot of really good experience. We had rural voices, we had urban voices, we had folks from the Black community, from the tribal community, Spanish-speaking folks, and just really a diversity of experiences in terms of what they were coming from. And what was awesome about the process is that it took a lot of just initial relationship building, trust, communication. We didn't start out making policy recommendations. This has been like a 3-year process to get there. So I always say, besides sustainable funding, is you need a heck of a lot of time, and you don't try to make something happen in 6 months or a year. You need to think, long term. So okay, so what else happened that I want to talk about? Because this is just a preview of what you're going to hear about if you can join our webinar a week from now, when we're going to go deep into this. So the next thing I want to say is just to briefly say that, how did we choose an advisory cabinet from around the state? And we used a variety of different indices around poverty or childcare deserts, access to healthcare, all those kind of things. And like I said, both urban and rural and tribal. So we ended up picking folks from Madison and Milwaukee, which are the 2 biggest cities in Wisconsin, as well as Adams County, which is a very rural and isolated poor county, and Beloit, which is a city about an hour south of Madison, and also from the Lakota tribe way up in northwestern Wisconsin. So there were 8 members from these 5 communities, and they've been participating for the last 3 years, building relationships, hosting and facilitating community conversations, meeting with the Department of Children and Families leadership. As Ruth and Michelle mentioned, our secretary of our Department of Children and Families came to every single of our quarterly meetings. And so we really felt like there was, that there was the respect was on both sides, in terms of the parents showing up to speak and the department leadership showing up to listen. And that was very meaningful, and I think very validating. So the process is ongoing, and you'll hear a lot more about it next week. And for now, I'm going to leave you with a quick video of one of our members talking about the project. And also, there's going to be some links that'll go into the chat from our annual report. There's also some lovely profiles of the members that you can learn about them, and other information to follow up on. So what you're going to hear from next is from Naila, who's one of our members, a parent from Beloit. And then after that, I'm going to pass it off to Dr. Adams, because her work was going on, as we said earlier, in parallel to all this work that we were doing with the Parent Caregiver Advocacy Cabinet. So I'm going to leave you with Naila as a little teaser. Naila will be there in person, well, on Zoom, at the webinar next week, along with my colleague Erin, and you'll get to hear much more. And here's 30 seconds to just kind of get you all psyched to come next week and hear more. So you can go ahead, Jonathan.
Well, I'm a teacher here in Beloit. I just got my 20-year recognition for teaching in the district. Got involved with community. I've always been really passionate about community advocacy and social justice. Had been part of many coalitions, and it always felt like we were doing a lot of complaining and not doing a lot. And it always felt like we were tokenized as parents, as African Americans, as like whatever group that they were trying to get feedback from. It didn't feel authentic. Was blown away by the way that they made sure that our voices were centered and heard. So I stayed.
Thanks, everyone. And now I get to pass it off to Dr. Adams. So take it away, Toshiba.
Okay, I'll wait for Jonathan to put the slide up, but in the interim, so hello everyone, my name is Toshiba Adams, and you have already been privileged with my bio, so I'll just start by saying thank you for joining us today, and to let you know that I am very excited to be in this virtual space with you all. So as Ruth and Michelle have already alluded to, we understand that Black and Brown early educators have been excluded from major discussions and decision-making processes around the early education workforce. And we also know that this is not just typical in a Wisconsin setting, but these are dilemmas and issues that are global for early educators of color. But yet we also understand that these educators have really historically been serving as the backbone to the early education system. They bring invaluable lived experiences, cultural capital, cultural knowledge, and really on the ground insight that can support the design and more equitable development of policies, workforce policies across the country. So recognizing this, the leadership team at Wisconsin Early Childhood Association, right? So recognizing that the early educators, Black and Brown early educators were missing from the equation, their voices were missing, their expertise were missing, as well as their insight or perspective on how to mold and advance equitable policy, public policy. They realized that. And so they decided to partner with me with the aim of better understanding and uplifting the lived experiences of workforce individuals here in Wisconsin so that we can learn from their experiences and, quite frankly, just do a better job at serving all of the communities. So in response to their ask or their request, in 2022, I believe it was, I developed a qualitative research study. And so I really wanted to engage early educators in a very meaningful way. And I wanted to hear about their struggles as well as their triumphs and the expertise that they bring to the field of early care and education. I also realized going into the study design that I did not want to just simply extract information from them, right? I just didn't want to come into an area or a space and listen to their stories, have them be very vulnerable, which many of them were very vulnerable as they told their workforce and social stories to me. And then just say, okay, I got what I needed from you. Maybe we'll do something with this, right? I could not be a part of that because historically that has been the case where we have extracted information from marginalized communities. We've done what we wanted to do with it, but we never really had the real intent of serving them in their communities. And as a woman of color, I could not be a part of a system that was going to marginalize these early educators. And I was a former early educator myself, so I understood their struggles. So I went into this study with a design that was going to allow me to more so partner with early educators. Like I didn't want to simply do research on them, but I wanted to ensure that I was designing a study with them, alongside of them, in a way that was going to benefit them, the families they serve, and the communities that they represent. So I did that by embarking upon what we consider to be a community-based research project or framework. And I'll talk a little bit more in detail about that in my individual webinar that'll be held in a couple of weeks. And so in order to make sure that I was partnering with them and actually hearing their voices, I invited some of these early educators who served as original research participants. There were 45 research participants for this study. And so I put out an invitation for them to join me, to work alongside of me, to develop this steering committee so that we can further analyze the research findings that I came up with to make sure that I was analyzing their stories in an accurate format, and then to also make sure that we were using those stories to align public policy in Wisconsin. And so 8 of those individuals were eager to work alongside of me. And so this Advancing Equity Steering Committee was formed I think it was like November of 2023. And we've been working together for a year and a half, meeting every month in a virtual and sometimes face-to-face space. And they have just been doing a phenomenal job with analyzing the research findings and determining how those research findings can elevate and uplift public policy for early education in the workforce here in Wisconsin. So I'm really proud of each and every one of them. I consider them my colleagues and my friends, and they've just been doing some really good work here in Wisconsin. So I will be presenting. So again, as Dahi stated, this is just kind of us giving you an overview of what we did, but we will each have a more in-depth webinar. So my webinar will be coming up on August 14th. And in that virtual space, I will be joined by Lisa Garley, who also served, and that's actually her at the mic at the podium, holding the mic at the podium at WICA's Advocacy Day. And so she'll be joining me in that virtual space, and we will be co-presenting. And so during that session, we'll take a deeper dive into the qualitative research design. I'll explain the type of design format that I embarked upon and why, and how that particular design was the best type of design to make sure that we were uplifting the voices of Black and Brown individuals in Wisconsin. During that session, we'll also share key findings from the study, but I also know that you have a link that will provide you with a snapshot of that qualitative research study, as well as an executive summary of the research. So if you wanted to kind of peruse and read through those materials ahead of time, please feel free to do that. We'll discuss the formation and the purpose of the Advancing Equity Steering Committee, which is still strong and viable within the state of Wisconsin. Again, these individuals have been presenting and collaborating with leaders such as Ruth Schmidt at Wisconsin Early Childhood Association, as well as Daria Hall, who is the overseer of our Department of Children and Family Services institution here in Wisconsin, which is our licensing and regulatory system in Wisconsin. So they've been doing the work and meeting with the leaders to let them know this is what we want to see done for our workforce, and the leaders have been responsive. So I'm eager, Lisa and I will be eager to kind of talk a little bit further in our session about the different policies that have been modified, changed, or implemented based on their voices. So finally, during that session, we'll just go and do a deeper dive in highlighting the policy priorities that the committee is working to move forward in Wisconsin's early care and education system. So again, I'm very proud of them, very proud of the work that they have been doing to move forward equitable policies and processes in Wisconsin. I see this upcoming webinar on August 14th as an opportunity for those who are interested to learn directly from a community-rooted research process and to engage directly with early educators themselves who are moving this work forward, who are shaping more just and inclusive workforce policies in our state. So I'm really excited if you haven't been able to tell by now. So I invite you to mark your calendars for August 14th, and we hope to see you in our webinar session in a couple weeks. So thank you for your time, and I'm going to pass it back to Dahi.
Thank you so much, Dr. Adams. I hope everybody feels like they're got enough of a sense or a excitement on both our parts of like how we want to share even more about this whole process with a much more in-depth webinar coming up. I think Susan, in a little while before we break, will give you the details about these. There's actually 4 parts to this series. So this is basically just the high level introduction to kind of give you the background and the timeline and to introduce ourselves so that then you can choose to come to any or all of the next 3. So the next one will be about the Parent Caregiver Advocacy Cabinet. And then about the next one will be about Dr. Adams' work. And then the final one will be kind of the, what comes next. It's going to be about the different advocacy tools that we use and how to engage those voices in that next step of not just listening and uplifting, but actually engaging and connecting with the policymakers, the legislators, the folks in the departments that are, that really need to be the ones that are hearing this and responding to it and crafting policy and budgets that actually reflect the needs of those communities and can, and make things better for all. And just to say, it's really important to thank and to honor the fact that this does not happen on the cheap. Like, you cannot do any of this work without funding, without compensating the educators, compensating the parents, compensating anybody in the community who is being involved and who you are soliciting input from. And I just say that over and over again. And Naila, when I talked to her the other day, she said, "Can I talk about that in the webinar?" And I'm like, "Of course you can." I mean, we need everybody to just say that all the time, that a $25 gift card does not cut it. It needs to be substantial compensation that honors the expertise and the lived experience and the knowledge and value of those parents and caregivers and their community voices. So what I want to say next is that this particular project that we've been collaborating on is been funded by the Robert Wood Johnson Foundation. And as part of this work, they are giving us funding to provide technical assistance to any other state or any other organization that feels like this is something we want to do. This is something that we've been thinking about for a long time, or maybe we've tried and didn't feel successful. So we are all available for technical assistance, and it could be an in-person phone call, it could be an email, it could be a webinar, but we are all our contact is going to be listed for Dr. Adams and me, and then my colleague Aaron next week. And we want you to ask. We want you to take advantage of this. And this is an opportunity. You could just ask a question. You could maybe you don't know what you want to do, or you're just curious. And that's what we're here for. The next three part of the series is to give you the in-depth, kind of storyline and roadmap as to what happened. But we know that's not enough, that, you might want to, really take advantage of the fact that we've been doing this for the last, 3 to 5 years. And that, we want to share what we learned, and we want to share it, and we want to empower other states and other organizations to do exactly this, because I'm sure that everyone feels like it's ultra important to do that, listening to that lived expertise and those community voices, and to have them be part of policymaking and part of change for the better. So lastly, I'm going to just say quick, because we're running ahead of time. If you have any questions for either me or Dr. Adams, I don't know, we could do that probably in the chat. So if you do, we could, kind of quickly cover those. And then in a few minutes, I'll pass it back to Susan to kind of summarize and tell you more details about what's coming up and all that kind of stuff. So there's a question in the chat: do you have an active infant mental health association in Wisconsin? I will start answering that, but I bet Ruth would follow. We have a fantastic infant mental health association in Wisconsin. I feel like they're a national leader. We work closely with them. They're part of Raising Wisconsin, and they have done just tremendous work to get funding and to raise the issue of the social emotional needs of our youngest kids. So Ruth, why don't you take it from there?
Yeah, I'll just add, we do. It's the Wisconsin Alliance for Infant Mental Health. They were very much a part of Raising Wisconsin in the planning phases and in the first year of implementation through the first budget session. And we have now financially contributed to their ability to start a coalition in Wisconsin that is very uniquely focused on health and well-being issues of very young children. Lana Nanide is the executive director there, and if you're interested in contact information, I'd be happy to connect you.
And I just put the link to the Wisconsin Infant Mental Health Association in there. So yeah. Great question. Ooh, another good question. Ruth, you want to start on that one?
Sure. What I can say is The advocacy work that was done on these issues this year were profound and amazing, including many members from the Advancing Equity Steering Committee that work with Dr. Toshiba Adams. They joined, they helped to facilitate the day. We did end up with a significant budget win in Wisconsin in terms of ongoing funding for direct payments to childcare programs. We saw the first of its kind investment of general purpose revenue into childcare in the state budget, which is absolutely enormous in Wisconsin that happened. We have seen increases in our subsidy that was markedly increased, I think, based largely on a lot of data gathering and storytelling, of course, done in partnership with the educators that have been involved in this initiative. And then sadly, we have also, I think, not entirely sadly, but there have also been ongoing, I think, pressure points on policies in Wisconsin that are probably not the policies we would necessarily have wanted to have seen happen this budget cycle. But when you go into really intense budget negotiations that must be bipartisan in nature because of the makeup of our state, we do consider significant financial wins, and we will absolutely continue to work on the policy front. That is especially problematic, I think, for educators that work with infants and toddlers.
Great. I just want to say, I wouldn't say so much in the way of big P policy, but I would say in some other small P policy areas. For example, our parent caregiver advocacy cabinet worked with the Department of Children and Families on their child care finder tool and improving it with their thoughts and their community needs from all the different places that they are in the state. And I felt like that was a win-win for for everyone in terms of that. Dr. Adams, did you have anything to add in terms of like what are some things that your group has been particularly wanting to see change?
So I'll take a deeper dive. We're going to cover that on the 14th, but just as like some surface level policy changes that we've seen in the collaboration with the Department of Children and Family Services. The research findings was stating that a lot of the early educators of color perceive there to be a lot of racialization and inequitable relationships that were built between themselves and the licensors. And so based on those findings, DCF now has mandated that licensors must have a background in early child education. That was one of our policy recommendations, that the licensors should have a background in early childhood education. And so since they met with our steering committee, they have made that change. So now as of this year, effectively this year, any licensors who are going out to supervise or to observe in the early education settings must have a background in early childhood education. So we thought that was a huge win. Also, the manager or the supervisor over the Department of Children and Family Services, the early education sector, anytime there's a posting, a job posting, she'll send it to me and she requests that I send it to the steering committee members and request that they please apply. We want to diversify. We've heard what you said. We know that we need to diversify and help us do that. So they have been very intentionally working with the members. It's been a very pleasant process, especially because a lot of the early educators prior to this process did not even want to interact with licensors or a manager over the licensing entity. At the beginning of this research, when I wanted them to work with me to share and disseminate their findings, they wouldn't do it. They were scared to be in front of a licensor or a manager of that program and be honest and genuine about their sentiments and their experiences. But since we've been going through this process, you'll see, I know you'll see, Lisa, you might see 2 early educators in a couple of weeks, but they come off, they turn their camera on and they speak directly with these individuals. They go into spaces face to face with these individuals. So that alone the way that the relationship has modified and changed to a more positive way over the last year and a half is also a huge win. DCF is changing some racial regulations. They're going to ensure that all of their licensors undergo a culturally responsive training process based on the research. They're putting in a credit for prior learning initiative. So there's a lot of it might sound like small wins, but they're huge wins for us in Wisconsin. They're huge wins for Black and Brown early educators who were bold enough to put themselves out and ask for what they wanted. And so we are hearing from some of the leaders about some of the policy changes. So that's just a little bit of what's happening. But there was, go ahead.
I want to jump on top of what you just said, Toshiba, just really briefly. So I've been working as a leader in early care and education in Wisconsin for like 23 years now. And for the first time, almost the first time ever, this last year, I would go into those meetings where we'd be talking about state standards or things like that with Department of Children and Families, and stakeholders are routinely included in that. But to be in those spaces and have members of the Advancing Equity Steering Committee called out as invited attendees joining those meetings has been, it's highly impactful to hear the stories told by members of that committee compared to stories that are told coming out of programs that are leaders in the state of Wisconsin and other geographies. It's an eye opener. I think it's so important for our field to be experiencing this in this way.
Thanks, Dr. Adams, and thanks, Ruth. We are now close to time, and I need to pass it back to Susan to tell what's coming next. And I think there's a survey and all the stuff you got to say, Susan. It's your turn.
Thank you so much. This was great. There is a last question. Is there any data on these changes attracting more men of color to the field? Is that anything that you might be covering in your webinar, Toshiba, or?
Toshiba, you're muted.
I'm sorry, I was reading the question. I'm like, what was no, I don't have any data that says that these changes are going to attract more men of color to the field. However, I have in another initiative, I worked with Wisconsin Early Childhood Association and trying to better understand how we can bring more men of color to the field, what systems and supports are necessary. So I do have some data on that. That was a separate initiative, but I can also I can share that information at the webinar in a couple of weeks as well. It's all funded through WICA anyway.
Yeah, and Jeremy, we might come back to that in a minute or so. So I just want to remind people, and it's earlier in the chat, and we can repeat it as well, the information about the next 3 webinars in this series. So the next one is Parents and Caregiver Voices. Why and how did we co-design an advisory cabinet? You can see it on the screen, July 24th. So that's just next week. And Aaron, who wasn't here with us today, and Dahi and Nailia will be the presenters. And then on August 14th, we'll have Toshiba and on early educator voices, why and how do we co-design research that translate to systems change. So you got a little taste of what that's going to be like. I think we're all excited to hear that. And then on August 21st, we'll focus on the advocacy efforts and what tools are needed to drive equitable policy and systems change. So we will send out as well, the registration links are in the chat. We'll send that out as well. We'll also send out all the links that we put in the chat for the resources. I know some of you had trouble getting to them while you stayed on the webinar. So we'll make sure that you get all of that as well as the recording. I think, and this will also be a way to connect to further technical assistance if you have requests for that. I wanted to mention that the National Build Conference is December 2nd through 4th, and we will have sessions that also will be with Wisconsin leaders about this work. And also, this is clearly, I think, an area of growth and advancement in the field overall. We are now seeing something that we used to talk about more as we know this is important. And now I think we really see people leaning in and doing work and living the commitment to parent and provider leadership, to this is actually practice in the field, not everywhere, not perfectly, but there's a huge change and shift over the last X number of years, where centering lived experience and building collective power, shifting power. This is a dramatic shift in parts of the field. And one of the things that was so noticeable is, in our request for proposals for the national meeting, we got 74 session proposals that were about centering lived experience. I mean, that's just not typical. And I think one of the things that I'm sort of eager to do is to bring together all the people who wanted to share their work on this and think across all of those efforts. Like, what did we all learn in these different ways, and see, what's in common and what's different. Because I think each area has its story, and some of the differences are about context and some are just because we tried different things. And I think it would be interesting to have that kind of level of sharing as well. And I'm going to try to figure how to build that into something maybe pre the December conference. But clearly the field is beginning to treat community engagement and the shifting of power not as a checkbox, but as a source of wisdom and strategic leadership. And this is critical. It's critical to systems change. It's critical to transformative change. It's critical to equity. And it's critical to all of our learning and to, getting to where we want to go. So thank you so much, Wisconsin leaders, for sharing the work that you've done with us today. And I think all of you who participated with us today, I hope that in the coming webinars, you'll have a chance to also tell us some of your questions and what you're doing that you're learning from as well. And that through the technical assistance process, we'll be able to engage in some two-way conversation about how to really make some of these changes stick and have more advisory boards and leadership shifts that we're seeing in Wisconsin. So thank you so much for joining today, and we will send all of this out. We really appreciate the work that you're doing. Thanks a lot. I hope there's a link in there's a link in the chat, I meant to say, to the exchange, which is also something that the Prenatal-to-Three Capacity Building Hub has. It's a place where you can continue this kind of conversation online, a collaboration across states and communities, and talk about these kinds of strategies. So if you'd like to join the exchange, or if you're already a member and want to talk about this webinar or just other strategies you're engaged in your community or state, please do join the exchange and talk to each other that way.
And fill out the feedback survey, please, when you get it.
Yeah, absolutely. We send out a survey after each feedback, and please do fill it out. It's a way for us to hear how we can improve and hear what other questions you might have. Thanks so much.